really sad to say that I'm not surprised by the findings in this report.
And those findings are somber tonight. Almost 200 people found dead on local streets. That's according to Multnomah County's annual Domicile Unknown report for 2021. Local health officials say the number of homeless people who died that year is the largest on record. Good evening. Thanks for joining us, everybody. I'm Steve Dunn.
And I'm Deborah Knapp. The report finds more than 50% of an increase in the amount of deaths from 2020 to 2021. Katu's Eric Mock joins us live in Northeast Portland. So, Eric, you've been combing through this report for us. What are the most troubling trends?
Well, guys, this report has a lot of findings that are frankly hard to read, but some of the most troubling are a rise in homicides among the homeless and a rise in drug overdose deaths.
These numbers, while not surprising, are still incredibly heartbreaking to me.
That's Haven Wheelock, the Drug Users Health Services supervisor at Outside In. She works directly with the houseless and says she knows some who have died.
People I have cared about and people I've been in community with and people I have been in service to are included in this report.
Multnomah County just released its annual Domicile Unknown report. It shows more homeless people, 193 in all, died in 2021, a death toll higher than any previous year since they started tracking it in 2011. And the report shows 4 out of every 5 deaths were not natural.
80% is a lot. Over half being overdose and drug-related death is really striking for me.
Many of those drug and overdose deaths she mentioned are from 2 drugs in particular. The report finds meth contributed to almost half of all the homeless deaths, 93 in all. That's the vast majority of all substance abuse-related deaths. Fentanyl is also a major player, contributing to 36 of those deaths. Wheelock says they're working with the county to get more naloxone into the homeless community. That's the life-saving opioid reversal drug. But meth is much harder to deal with.
There is no immediate medication to treat a methamphetamine overdose. There's also currently not any FDA-approved medications to treat methamphetamine stimulant use disorders.
Another disturbing finding in the report, the increase in homicides among the homeless. Homicides more than doubled from 8 in 2020 to 18 in 2021. Including 13 deadly shootings. I asked Multnomah County Health Officer Dr. Jennifer Vines whether they should be worried about that finding.
You're absolutely right. I think homicides, gun violence in particular, is an issue that is countywide. And, we see it show up in this report, certainly.
We need middle-income housing. We need low-income housing. We need help and supported assistance to help people who are chronically homeless.
Representative Al Hoyle emphasizing the need for more housing after touring 2 of Eugene's safe sleep sites. Thanks for joining us. I'm Kendall Bartley. Brandon Cameraman is off tonight. Launched in 2021, the program's last remaining site, Chase Commons Park, has yet to open due to construction delays. When that park does open, together the locations would house nearly 300 people. But the funding for it is set to expire next year, and the city of Eugene is trying to get more funding to keep the sites running.
I'm working in a bipartisan way to make sure we keep this funding happening and that we invest it in the right way at every single level, whether it's HUD Section 8 housing vouchers, investment in programs that can house people, supporting, again, the private sector investment in middle-income housing. All of it matters, and it's going to take, many hands make light work, and so we need many hands.
As of January, Lane County's Human Services Division reported more than 4,800 homeless people in the county. The waiting list for the Safe Sleep Site program is close to 1,000 names long.